Lights, Hope and Possibility, Silent Depression in a marriage or a close relationship or with a loved one. What is silent depression and how prevalent is it? You may be surprised here next on Hope and Possibility.
Dr. Gregory Jantz is a best-selling author of over 45 books and the founder of the Center A Place of Hope, voted a top 10 center for depression treatment in the U.S. As the pioneer of whole person care, Dr. Jantz is known as the messenger of hope. Now the nation's expert on anxiety, depression, substance abuse, relationships, trauma, and PTSD, here is Dr. Gregory Jantz.
Okay, the term silent depression, what do you mean? Okay, depression is so common, as we already know. Post-pandemic, if we can say that, depression rates have certainly skyrocketed and they are not slowing down. Today, right now, depression is the second most common diagnosis. So a depression diagnosis of some sort. When you go to see your primary care physician, one of the things they ask you is a series of questions to find out if depression and or suicide is a part of your profile and if you need additional help. With that is also related questions to anxiety. When I say silent depression, there's so many people that are suffering. And when I wrote the book, Healing Depression for Life, which is all about the whole person way of treating depression, which is, again, a little different. The things that we've been doing here at the Center, A Place of Hope, now 39 years, are a little different. We're going to look at, even with depression, what are the sources? Is there things happening in the area of spirituality or faith? Are there things happening in our emotions and past trauma? The new book, by the way, this is exciting, Triumph Over Trauma. Trauma is huge for somebody who is suffering from a depression. Silent depression is something that we work hard to hide. Now, a lot of depression, we reach a point on that continuum of symptoms and we end up, eventually people know, they notice, and loved ones will notice that something's wrong. You're not quite yourself. As you look at depression, it's pretty common. Again, back to seeing your primary care physician who's writing 80 plus 90% of the prescriptions for an antidepressant or an anxiety medication, because that's what we've been trained to do. We show the symptoms and what is the plan. We write the script, get the antidepressant. I want to make sure that we're doing more than that. That may be an important step, but let's do more than a simple singular approach. So that's why we're going to look at, is there been trauma? That's why we're going to look deep into the physiology. Is there brain chemistries that are off? What about what's happening in the digestion? Our gut is called the second brain. Are we producing in our gut through our intestinal flora the ingredients that manufacture serotonin, dopamine, key neurotransmitters for depression? That originate in the gut and communicate and travel via, there's something called the vagus nerve from the gut to the brain. It's a highway, and if that is not functioning, you will have a depression. So we want to cover all these bases physically, medically, in our relationships, in the things we believe, etc. That's why today I want to introduce this idea of a silent depression. Let me just say, a silent depression in marriage or a close relationship that you're very close with this person and it's been years of closeness. Let's talk about, what does silent depression do? See, a person can actually be suffering from depression and not realize or understand that it is depression, not understanding what this is from, what this is about. They can have a slow eroding depression. It starts off slowly and then you get on the continuum, it's way over here in some deep clinical depression, and go, what happened? How did I get there? And plus, here's the danger. It feels normal. It feels like, wow, this is normal. And so what we look at is it's not normal, but how do we get to the core issues that created that? In some families, in some relationships, let's just use marriage as an example, one partner could be a person that's really struggling with depression. It's been hid. We've never ever used that label to describe it. And we know that the depression is such that it is controlling a lot of mood, decisions, emotions, behaviors, and it's caused a person to withdraw. It's caused a person to sink deep back into really ultimately a real dark place. You see, depression, this is why there can be, I call it a spiritual battle. There's a depression that is a battle. It's a battle for your mind. It's a battle for your life. And so I look at depression from this whole person vantage point going, okay, what are the key reasons, the key sources? So here's what depression, a silent depression, one we've been hiding, one we've never labeled as depression, one that we've maybe functioned this way for a long time. Here's what it does. Number one, it erodes intimacy. I've made some great notes for our time together today, and the first item that we want to discuss is a silent depression, one we're hiding, one we're maybe self-medicating through alcohol, through food, maybe through a misuse of prescription drugs, and we're just doing things that are not healthy, and we're trying to cope with something that's going on. We don't always know what it is. This will, between two people, it's a slow erosion. I call it an erosion because it is such that you don't even realize how far you're sliding down. You don't realize that this is really an issue, and you don't know what to call it, but you know you're not feeling well. Well, that causes us to pull away in relationships. It's hard to be close because you don't feel good about yourself. You don't have the energy for a relationship. And so just the closest that you might have enjoyed in the past isn't there. You find yourself moving away from your loved one versus moving towards. You'll find, and two words I use to describe this is emotional isolation. Emotional isolation. We hide our emotions, we hide ourselves, we're pulling ourselves away. Okay, it's slow, it's subtle, but before you know it, we don't feel close. We don't feel close in the relationship, and we don't really understand what's going on, but we don't feel connected like we once did. We find ourselves maybe being deceptive about our feelings and emotions. We pull away. This is significant because you're going to be isolated more and more and more. Emotional isolation. You're going to feel alone, and you're going to feel alone and lonely. And it's going to feel like nobody understands. And the suffering really is in silence. It's suffering. It's a silent suffering. Number two, a silent depression in a close relationship, such as a marriage, you'll lose your sense of self, your self-identity, your self-value, your self-esteem, who I am in this relationship. Your self-esteem gets lowered, and that's just how you see yourself and your opinion of yourself. Your sense of having any value in the relationship diminishes. The word I wrote down here in the notes in preparing for our time is the word apathy. Apathy. I become apathetic. I don't have the energy to care. I don't care about myself. Self-care may go out the window. It's like it takes energy to brush my teeth or to take a shower or to clean up. I just don't have the energy to care. You'll start saying things like, I don't think I really matter. You'll start saying things like, I just got to get through this day. Now, I'm not saying you're suicidal at this point, but you've totally lost your sense of self, and in my vantage point, who God made you to be, and that sense of self, that sense of of I have value. You don't feel that. Number 3, there's going to be emotional hypervigilance. Emotional hypervigilance. What is that? You're going to be super sensitive to your loved one. This is the silent depression in marriage or a close relationship. You're going to feel moody. You're going to feel like no matter what, nobody can really please you. And it may surprise you a bit that you feel this way, but you're super, super hyper vigilant, super sensitive, and nothing is going right. And your loved one doesn't treat you right. Nobody understands. And this is extremely difficult for the person that's in the relationship that really wants to understand. They really want to care. And they may be feeling like no matter what I do, it doesn't matter. It doesn't matter. And that's a challenge. So here's key things to look for here. Emotional hypervigilance. I'm easily overwhelmed and I'm easily irritated. Easily overwhelmed, easily irritated. And you feel like you've lost that bonding. You know, that bonding that we had when we were tight and we were together feels like this is gone. It feels like this is broken. I can't get reconnected with the one I love. So, all right. Now, there is bonding and attachment in healthy relationships. Not a codependency, but a healthy bonding. We're connected. We're attached. We're feeling that oneness and that sense of unity. Okay, when you go through this and the silent depression, those bonds, that sense of attachment is gone. It's not there. So this sets us up for number 4. Number 4 is long-term suffering. You may have been in this relationship for 15, 20 years, maybe longer. And you just feel like I'm always suffering. Nothing is ever right. With this comes, we know that medically and physiologically, there's an immune system suppression. Our body may be pumping extraordinary levels of cortisol. Our body may be pumping not only cortisol, our body may be overworking those adrenal glands and the adrenaline. You may notice headaches, heart rate goes up, and you just don't feel good. Aches and pains. You don't feel good physically. And it can really move you over the edge where there's despair, there's despondency. I kind of am leaning over into it becomes a dark world of despondency. It becomes a dark world of despair. I remember the other symptoms are I don't matter, I don't have value, I'm apathetic. And this is a scary place to stay, the long-term suffering. Eventually, a person can decide, my life really doesn't matter. My spouse, my loved one, be better off without me. And I'm just not going to live anymore. And you start to shut down. And you start to say things like, it'd be better off if I wasn't even around. It'd be better off if I wasn't alive. And that's where the thinking goes. So keep that in mind, the long-term suffering, because we got to move out of long-term suffering. All right, number 5, we need to look for the codependency versus an interdependency. Silent depression, I become codependent, or my loved one becomes codependent in caring for me. And we kind of have this weird cycle going on of need, and you feel like I can't live without. I'm going to take care of this person who's suffering, my loved one, and you overcare for them. They get worse. It's just a very interesting cycle that can emerge when you're in this long-term suffering and the silent depression, because nothing really gets better, but we stay in this vicious cycle, really. And it's a cycle that promotes more despondency. All right. Now, the other one we need to look at, number 6, is spiritual misunderstandings. We can, for those that are really, the faith is important, and perhaps scriptures could be really important, there can be the misapplication of scriptures, the misuse. And if you would only do this, God would have healed you. And we began to look for answers, but we misapply scriptures, and it really puts a sense of shame and guilt on the situation. And that shame and guilt adds to the despondency. And if you think of this silent depression, you're going deeper and deeper and deeper in the dark cave, and you don't have a flashlight. And you don't know how deep this goes, but you're also afraid to come out of the cave. And as you come into the light, you feel overwhelmed, and you don't believe that there's any hope. So we go deeper and deeper into the despair of the cave. We may avoid things, avoid church, people, social gatherings, and it is the old avoid one another. Think about this. Depression causes us to avoid conflict, avoid people, avoid self-care, avoid. So this is so incredibly important that we understand this, because avoidance leads to additional despair. All right. Well, what do we need to do now? Okay. We've got to receive a life preserver that's thrown to us, probably from a non-family member. Our family's probably done all they know to do. And if you're the family member and you've been trying to help this person you love greatly in their suffering, and you may feel great frustration, you feel a little bit of helplessness, or a lot of helplessness and hopelessness. So what happens? Well, what happens is this. You end up feeling like this is the way it's always going to be. So outside help, sometimes we need to do an intervention. We need to intervene on long-term suffering. And usually, when I say intervene, it could be a pastor, a counselor, but a person with great skill and knowledge is going to help intervene to help us start to put together a plan. That usually means getting professional help, the right kind of help. But for me, it's the whole person help, where I'm going to look at all areas, emotionally, physically, spiritually. I'm going to look at what's going on medically, what's going on in my relationships, what's going on intellectually, what's going on with my life purpose, my calling, what's going on in guilt and shame or unforgiveness, bitterness. So we need somebody to begin the process to help us cleanse of all the excess toxic emotions. Help us with that, and begin to speak truth into our life, and to really, it is a drain of toxic emotions. It's getting the poison out, but doing that through sound help, skills. For me, it's a prayerful approach for wisdom, discernment, what needs to be addressed. Truly, it can be different for everyone. There's no single secret sauce. The issues could be different. They could be from far ago, long ago into history. And this is why so often the silent depression has a trauma that is hidden, a trauma that is present from past abuse, past loss, but there's been a trauma that's been buried. And so then I've suffered in silence for so long. So as I suffer in silence, I grow in despair, and I grow despondent. And again, If I'm living with this person and review the erosion of intimacy, I'm going to lose my whole sense of self, who I was created to be. I'm going to feel some emotional hypervigilance, in other words, very high sensitivity, as well as I'm going to put myself on the road to some long-term suffering. And I may have some real codependency in the relationship. There could be some misuse of scriptures or misapplication of scriptures in a person's life that says, this is why you're this way. So silent depression, that depression that we've attempted to bury, to hide in that deep, dark cave and disconnect from people, disconnect from relationships, and disconnect from life. It requires a healing and a reconnecting, and it needs a plan. If we say, well, I'm just going to get better, that doesn't happen. If I'm just going to go, I'm going to go talk to this counselor maybe 2 or 3 times, it's not going to change it. I've got to have a comprehensive, whole person plan in order to have healing and recovery in my life. And usually it's done best when we work as a team of professionals. I want to know what's going on medically. As your immune system becomes so compromised, are you so low in vitamin D? Is hormonal levels off? All this needs to be examined and looked at. And this is a key to long-term whole person healing and recovery. It's what we've done now for 39 years at the center. And that's why we do it as a team. And I do believe, as I brought this up a couple times, there is a triumph over trauma. And that trauma might be that silent depression that's been very, very difficult in a relationship. We have to make a decision to get the right kind of help and to stay in the game. There's hope. I can tell you there's hope. Hope comes when there's a plan, and that's part of what we do. It's the creation of a plan. There's hope. There's great hope, by the way. And good to be with you today on an interesting topic of silent depression that we want to bring into the light. Bring it into the light and get a good plan together. A plan of hope.